This lecture will cover the opportunistic mycoses. The opportunistic mycoses are saprophytic, which means they live off dead and decaying matter. And so this can sometimes make it very difficult to diagnose them, since it can pretty much be found anywhere in the environment. And sometimes it's difficult to know when it's grown on a culture plate if it's an actual contaminant. So you really got to kind of judge where it is on the culture plate as if it were, you're looking to see if it were actually growing within the culture streak where you put the culture onto the agar, or whether it's growing outside of the streak. So those are things and skills that you will learn once you're in the lab to be able to recognize when something is a contaminant. So these organisms typically cause some sort of tissue invasion in individuals who are immunocompromised. So it's very important to make sure that you're working up this fungus when it's an immunocompromised patient. They're typically acquired through various aspects throughout the environment. So it could be situations where there's construction or demolition, especially in older buildings, any sort of remodeling, and sometimes there can even be situations where it's acquired through a hospital visit, that you get an infection, a hospital-acquired infection through these organisms. Aspergillus is found throughout the environment. The conidia can break off very easily, so you can see up here in this image where the conidia are just kind of attached to little phthalates. So those conidia can break off and can go throughout the environment through the air and are breathed into the host. It typically affects the immunocompromised host starting with a pulmonary infection, then it can progress to more of a disseminated infection. Aspergillus is seen in the clinical setting a variety of ways. Three of the ways that we typically see them are through allergic reactions, or through the production of a toxin, or through some sort of opportunistic type infection. Aspergillus causes a wide variety of disseminated infections. Some examples would be a fungus ball. It could be of the sinus, or it could be of the ear, so you can see that example here. It could be cause an allergic type reaction. It could affect the sinuses, it can affect the heart or central nervous system. An Aspergillus infection can be detected using an antigen protein-based assay where you look for beta-D-glucan in serum, although there are other organisms that can possess beta-D-glucan. It is a rapid growth organism. It usually matures in about 3 days, but there are some species of Aspergillus that are a little bit slower with their growth rate. When we look at the macroscopic morphology, it can tend to aid in identifying the species of Aspergillus based on the color of the colony. Aspergillus fumigatus is a thermotolerant organism, so it's able to withstand higher temperatures, so temperatures up to about 45 degrees Celsius. So here you have a color chart of some of the more common species of Aspergillus and what the surface of the agar looks like with the colony, and what the reverse side of the agar looks like with the colony growing. So for the microscopic identification, this organism has a septate hyphae. So you can see in these images where there is a division in the hyphae at the bottom. And you also have an unbranched conidiophore. So this stem does not branch off, it just comes straight up. And it's attached with a foot cell. So the stem itself, or the conidiophore, comes down and out, so it attaches onto the septate hyphae. There's no division where it attaches to the hyphae. It actually has sort of like a little foot. So that's called a foot cell. Then the vesicle itself, which is this little radial type head up here at the top. It is attached either through with the attachment of phyllodes that are attached directly to it. So you can see this image over here where you've got the phyllodes that are attached directly to it. So you can see where they're like little finger projections coming off. Or they can be attached to a metula or metula, depending on where you're at, how it's pronounced. And so you can see those are a little bit larger, and then you have the phyllodes attached to them right here on the end. So I'm kind of marking that in there. The phyllodes have conidia coming off of them, and the conidia form chains. So you can see all of those little long chains coming off of both of these species. So here's a list of 4 of the most common or more common to what you'll see in the lab. They all look very similar as far as the Aspergillus species, with how the phyllodes are attached to the vesicle and given this sort of dandelion look. But what you're looking for to distinguish one from the other is the vesicle itself, how it looks, as well as the phyllodes and the conidia, how they're attached. So with Aspergillus fumigatus, you'll have a very large vesicle. So you can see a large vesicle here. And then what you'll have is bottle-shaped type of phyllodes that are covering the surface. And so you see how they're just kind of, it's really hard to see really that what they are, that they look like a bottled shape. But they're coming up straight from the vesicle. And then from there you have all of these little conidia that are attached to them, and they're just kind of hanging out there. Some of them have already come off, so you can see those around on the side. So they're really small. With Aspergillus flavirus, you've got a very large vesicle as well. It's kind of going to be big. And again, those phyllodes and conidia will be attached to that vesicle, except the main difference you're going to see is they may have a little bit of a tint to them, a yellowish orange tint. With Aspergillus niger, it is a spherical type vesicle, so it's going to be rounded all the way around. And you can see an image of that here at the bottom. It's kind of hard to see that vesicle, but it is rounded. And with those phyllodes and those conidia, you're going to have them coming all the way around it. So you can see this one here that's laying on the side. So you can see this conidia 4 come up, and then you've got that rounded vesicle in there. It's like a little spear shape. But then you have all of these phyllodes with the conidia attached to it coming all the way around it. And you can also see that it's a very dark brown color. So that is very characteristic of that species. And then with the Pterias, you've got, it's going to be more of a part of a circle or a half of a circle. And it's going to be, the surface will be covered as well. And it produces a very large type conidia. And that's it. And so here are just some more images of some of those where you can see how some of them are shaped a little bit different. So you can kind of see in comparison of these two where you've got this shape versus this shape of the vesicle. And then they just kind of come up, attached to the metula or the phyllodes, or the metula and phyllodes, and then all of those come up. You can see how long these chains are right here. And then again, some of the more classic images, but they all still have that similar look. You can see that little bit of a yellow pigment in these right here in the center. So you can see that little yellow pigment that's coming off of those. And of course you can see the dark pigment, but they all look very similar with that little dandelion look. The Penicillium species are very virulent for the AIDS patients. And they cause a variety of infections, like infections of the eye, inside the eye, the ear, esophagus, lungs, heart, abdominal lining, and urinary tract. For the macroscopic appearance, it has a variety of colors that it will present as, from various shades of green, and you can see an organism here that has various shades of green within that one organism. And what you're looking for on the microscopic view of this organism is you're looking for septate hyphae, and you're looking for something that appears very similar to a paintbrush, or it could appear, in some people's opinion, it looks like a skeleton hand. And so you're looking for that organism to, it may branch or it may not branch out towards the end of it. So you can see some branching here, or this particular one doesn't branch. But you see where the mitella is attached to phyllids on the end. In this organism, the phyllids attach directly to the conidiophore. And then on the end of that, you're looking for all of these conidia to make that paintbrush type appearance. So this one over here, you can see that those chains are very long, and this one gives more of that little skeleton hand type look, as well as this one. And then you can see all those conidia at the end.